Thanks for taking the time to be with us here today for this webinar, Understanding and Addressing Vaping in School Communities. I'm Dr. Alex Gist. I'm a health promotion specialist with the BC Children's Hospital's Health Promotion and Schools team, and I'm excited to learn alongside you today from our panelists and speakers. I'd like to start by acknowledging with gratitude that I'm joining today from the traditional, ancestral, and unceded land of the Lekwungen people of the Esquimalt and Songhees Nations. And the BC Children's Hospital sits on the traditional, ancestral, and unceded lands of the Musqueam, Squamish, and Tsleil-Waututh peoples. The parent organization of BC Children's, PHSA, was gifted 6 Coast Salish teachings by Coast Salish knowledge keeper Solkson. The teachings ground us and offer guidance on how we may do our best as human beings and show up in relation to one another. One of the teachings is I Slachsen, good medicine. And this teaches us that medicine is all things, the geography, the ecosystem, the water, and all other living beings. And as human beings, we can choose with intent to be good medicine every day. And as we start this webinar, I'm really energized that so many of us on this webinar today are working to be good medicine for the young people and the school communities that we work with. As I mentioned, I work on the BC Children's Health Promotion and Schools team, which works collaboratively to enhance capacity for system-wide changes in school communities that improve student mental health and well-being by providing coaching, resources, and professional learning. Our team works closely with the Kelty Mental Health Resource Center, which many of you are likely familiar with. And for more information on our work for school communities, you can visit keltymentalhealth.ca/school-professionals. Just want to touch on a few housekeeping notes. So all attendees are automatically muted and cameras are turned off. Please submit questions for the speakers through the Q&A function. We will have a short Q&A, which I'll get to in a sec. Please submit technical questions or comments through the chat function. At the end of the webinar, a survey will pop up that we invite you to complete. This webinar is being recorded, and the slides and the webinar recording will be emailed to everyone who registered and will be available on our school's website, which you can see there. And just to note that this webinar was developed for the context of British Columbia. If you're in another jurisdiction, well, first of all, welcome, but please consult local health and school authorities for further information on this topic. So just a quick overview of what the next hour will look like. So we just had a brief welcome, land acknowledgement, housekeeping. We're going to start with a short presentation to provide a foundational understanding of the issue of vaping and vaping in schools. Next, and then we'll have a fulsome panel discussion with our expert panelists. We'll have a short time for Q&A with any questions you might have, and a reminder to put those in the Q&A function in Zoom. And then we'll have a short wrap-up. So with that, let's get into our presentation. I'd like to introduce our speaker, Priscila Nabuco. Priscila is a legal substances coordinator at Interior Health, specializing in novel nicotine products and youth prevention strategies. With a background in psychology, she leads a school-based vaping alternative to suspension pilot and develops targeted resources for youth, parents, and educators. Her work builds on extensive experience supporting youth mental health in both educational and clinical settings, with a focus on practical, evidence-informed approaches to addressing vaping among school-aged children. So welcome, Priscila, and take it away.
So again, thank you for having me here today. Before I start, I want to acknowledge that I'm calling in from the Ktunaxa, Syilx, and Sinixt Converging Territory in a town colonially known as Nelson in the interior of BC, where I have the honor to live, work, and play. So to kick us off, I'm just going to share some information, some basic information about vaping, particularly vaping with nicotine. You will hear me talk about it and refer to these products as e-cigarettes or vapes throughout the presentation. And I will mention specific substances if I'm talking about something different than nicotine. For example, when I briefly speak about cannabis today. So let's start today by defining what e-cigarettes are and what's in them. An e-cigarette is a term that we use to define battery-operated devices that we use to aerosolize a solution. And this aerosol is what we often refer to as the vape or the cloud that people inhale and exhale from these products. So the solution or the liquid in the vapes usually contain a psychoactive substance like nicotine and cannabis, and the regulated products in BC will contain either of those and never those together. And that's not to say that these products can be tampered, but that's the legal products will contain. They do not contain tobacco and has not been associated with traditional and medicinal uses of tobacco by Indigenous youth either. So the nicotine most commonly found in disposable vapes and cartridges are the nicotine salts. And those nicotine salts are a different form of nicotine that they're modified from the pure or free-base nicotine that we would take from the tobacco leaf. So the nicotine salts are smoother to inhale and they get absorbed a little faster, helping the users vape more often and making them able to use a little higher nicotine concentrations and then being associated to a greater risk of developing addiction as well. We also have a carrier for nicotine in these liquids, which is usually propylene glycol or glycerol, which is vegetable glycerine. And while propylene glycol is considered safe in certain amounts in foods, inhaling it can actually lead to inflammation of the airways and lungs, breathing problems, and cellular damage as well. Vapes also contain flavorings, and with that comes various other chemicals that can vary quite a bit. And the flavorings are known to also make them vapes more appealing to youth. Studies also show that e-cigarettes, the aerosol or that cloud, often contain other chemical compounds, heavy metals, and some of those chemical compounds are known to cause cancer and be harmful to the health. So from this basic information, we can see that e-cigarettes are not harmless products. And while we might still think that they are potentially a less damaging alternative for people who are smokers and switching over to vaping, more and more emerging evidence points to greater harms from using these devices, especially for those who do not currently smoke. And really the key message for youth is that these products are harmful, especially for younger folks whose brains are still developing. E-cigarettes are often small and they can look like common objects, but there's also a lot of innovative ways the industry is using to captivate new users. So like this vape that you can see here that is inhaled through the nose called Nosy, or the one that is embedded in the hoodie drawstring, which makes them easier to conceal and access anywhere. And more than a product, vapes have really been successfully marketed as part of a lifestyle and now has permeated and infiltrated youth culture, making it a more complex issue to address. Now let's explore how nicotine works, as this is one of the great concerns that we have when it comes to experimenting and using vapes. When a person consumes nicotine through an e-cigarette, it enters the bloodstream and reaches the brain quickly, triggering a release of dopamine and other neurotransmitters that activate the pleasure, survival, and learning areas of the brain. The person then experiences a sense of temporary pleasure and well-being. It briefly relieves stress, pain, improves the feelings of tiredness because it's also a stimulant, improves their overall mood. And the release of dopamine activates what we call a reward pathway in the brain, which is how we learn to do things that are important for our survival, like eating food or drinking water. Drugs like nicotine hijack this reward pathway in the person's brain by making it release way more nicotine or way more dopamine, rather, than the survival activities normally would, making it feel like a high priority behavior. So teenagers' brains are even more vulnerable because they already release dopamine in a different way, and their impulse control and reasoning areas of the brain are still developing. And as the nicotine levels drop, especially, which happens really quickly, especially if we're talking about nicotine salts, the brain might crave more nicotine to sustain that pleasant effect, and the person might seek another puff. Repeating the cycle then reinforces the brain to learn that nicotine is a good and it's necessary, and that can lead to dependence and developing addiction. And it's important to remember this and how nicotine works for two main reasons. First, because it helps us understand why it is important to prevent or at least attempt to delay the nicotine use, and also to understand that withdrawal might be playing a part in the vaping behaviors that we're seeing on school grounds. Nicotine withdrawal can create intense feelings of anxiety, high heart rate, cravings, irritability, and can be uncomfortable and distressing for the person. So if teens think that vapes help them manage stressful situations, which we hear a lot, chances are that vaping is reinforcing this notion because using nicotine is also creating feelings of anxiety and distress. And let's talk a little bit about the risks involved in vaping. So what are the concerns that we have in terms of the physical health? Vaping nicotine comes with a lot of risks related to the developing brain. Besides being very addictive, vaping has been associated with poor mental health indicators, including those associated with mood and anxiety disorders. It also impacts the cognition, even after someone quits vaping. And it's thought to change the activity on the attention, memory, and learning areas of the developing brain. And it can also affect the impulsivity and mood. Research also points to a higher likelihood for young people who vape to start smoking, which greatly increases the potential risks for their health. Nicotine use can also cause acid reflux because it affects the gastrointestinal system, and it can cause other problems like mouth sores and chronic heartburn. About the heart health, we know that nicotine makes the heart beat faster by a similar process that activates the fight or flight response. We also know that the aerosol in cigarettes also damages the cells in the circulatory system. And all of this, and with other factors together, contributes to a higher risk to heart and vascular disease, which seems to be very similar to what we know of smoking, which is leading us to believe that maybe vaping is not reducing that much risk, especially for the cardiovascular system when comparing to smoking. And we also know that many users report persistent cough and shortness of breath. And although we're still learning about the long-term impacts of vaping, we know it affects the respiratory health negatively. So what does the data say about how common vaping has become? I'm sharing here some information from the BC Adolescent Health Survey of 2023, which collected at schools across the province. And we know from that survey, 26% of the students had said that they had vaped at least once. And of those, over half had vaped in the past 30 days before the survey. We also learned that the students are starting really early. So you can see in this chart here that 87% of those who had tried vaping did so before they turned 16, with the first puff usually happening around 13 years of age. I also wanted to highlight that 7% of the students who had vaped those 30 days before the survey had also used the product to stop vaping, which shows that some of our students have a desire to reduce or quit, and there might be an opportunity to engage the young people in that as well. Another interesting trend to note is that half of the students who said that they vaped had also said that they had smoked. And those who did both were 3 times as likely to have vaped first than they were to have smoked first. So there's some association there with starting vaping and progressing to smoke potentially. And why are teens vaping? According to the Canadian Tobacco Nicotine Survey of 2022, when they asked the teens between 15 and 19 years of age what the reasons why, the majority, or 30.5%, said that they did so to reduce stress, followed by curiosity at 27%, and 22.9% because they enjoy it. And we have to recognize that people might use these products for multiple reasons, and these reasons might change over time as well. And speaking specifically about stress, stress really is high on the students' minds. The BC Adolescent Survey of 2023 also found that 89% of the youth experienced at least a little stress in the past month, with students in higher grades more likely to experience extreme stress. The cycle of how nicotine withdrawal works might be reinforcing that idea again because of how it can actually lead to the overall worsening of these symptoms and might be preventing students from seeking other coping strategies for reducing their stress. I also wanted to share a bit of educators' perspective on this issue. According to a recent report issued by the Wellstream at UBC, vaping is the substance use challenge most frequently managed by school administrators across Canada. I'll share a graph that is not exclusive to vaping, but you can see that administrators are saying that they're spending between 1 to 5 hours, the majority of them, dealing with students' substance use issues at school. And we can infer that by vaping being probably representing a good portion of the time, because it leads to a lot of investigation of the incidents, and it's a prevalent issue in schools. Cannabis seems also to be a prominent issue, with part of it likely being consumed through vapes. And from a specific cannabis report from the Adolescent Health Survey called the Blunt Talk, we heard that the students who vape said that they did so because it's easier to hide, it's easier to use in public, as well as to avoid the lingering smells in their clothes or on their fingers from smoking. And it was also specifically preferred as a way to use at school because people often assumed that they were using nicotine instead of cannabis. And let's talk a little bit about solutions as we wrap up. Addressing vaping really requires a multi-pronged approach. It is a complex issue, and it has multi-layer factors that we want to address here. So here are some evidence-based recommendations for schools, and you might recognize that some of them are already in place in your school. So first off, we always want to focus on promoting overall health at school through a supportive environment where the students have the opportunity to foster their physical, mental, social, and intellectual development. And we know that has great health benefits and prevents harms associated with substance use. Some ways to do that include promoting social emotional learning opportunities, encouraging health behaviors, and creating a sense of belonging to the school community. Specifically about policy, we know that district and school policies can have a big impact on students. Related to vaping, it's important to have a comprehensive policy that states educational efforts for everyone and offers supportive, non-punitive approaches to incidents that can be tailored to individual circumstances. In terms of knowledge, schools also need to stay sharp on what they know about this. These products evolve and new trends and evidence emerge, so we need to be on point on that. Well, we want to focus that all staff should know about the district schools and the policies. We want people to understand the product and know about curriculum options and stigma reduction strategies. That will allow for a unified approach that helps all the students feel safe and supported, whether they vape or not. Speaking of specific education opportunities related to vaping for your students, I know it can be tricky to navigate all the expectations and all the information available out there, but based on what we know from smoking and what we're learning about vaping, we want to start educating students early, before exposure is possible. Remember, most kids start between 12 and 15 years of age. Let's focus on age-appropriate content that is evidence-based and trauma-informed. And that's crucial because we know from the evidence that things that are not based on current evidence can actually lead to more harms. And from the content, in addition to the information about risks and harms, we also want to address other factors that influence vaping, like the reasons why people vape, demystifying the idea that everyone is doing it, learning how to cope with stress and learning refusal skills, how the media influence people's behaviors, and so on. We also want to allow the opportunity for the students to develop some self-reflection and discuss about the topic with your guidance. Many of these topics support positive youth development by building on the student's strength, which we know prevents problematic substance use as well. You may also want to engage your parents, who themselves are trying to navigate the ever-changing landscape of risks for their growing children. You can encourage parents by offering information through newsletters, presentations, and resources, as well as some information on parenting skills like how to talk to your teen. Lastly, but very important as well, is informing students about quitting support. We know that some students are ready and trying to quit. Schools can be where students find the support that they need to succeed, and also acknowledge that not all students will be interested and able to quit at this time, but in keeping the conversation open and sharing information, they might come to you or to those resources for support when they are ready. If you're trying to make improvements on how you address vaping, you can reach out to health authority partners like teams of my team and my colleagues for advice and support. And we'll offer some suggestions on things that can be done at the school and district levels. To close our presentation portion of this webinar, I'm going to share just 3 resources that might be helpful for your students. We have Quit Now, that is a provincial free program to help people in BC to quit or reducing smoking or vaping. We also have Talk Tobacco, an Indigenous quit smoking and vaping support service that offers culturally appropriate personalized support. Both services count with quit lines, texting, and live chat services guided by quit coaches. And Talk Tobacco also has links to local programs and is available in 16 Indigenous languages. Both programs and web pages have lots of helpful tips and count with virtual groups for extra support. These services can be done anonymous, which can reduce some of the barriers for the kids accessing these supports. There's also an app made for young people who want to quit called Quash. It helps the user build a personalized plan for quitting or reducing. It also has great tools to track progress and manage stress, cravings, and deal with setbacks. For those interested, Quash also offers free online training for adults interested in guiding younger folks in their quitting journey. And I also wanted to highlight that you are a specialist in your community support services as well. So lean on maybe your providers for mental health and substance use services for youth in your region, including Foundry. And those are places where you can find some support for your students who are trying to access support for managing their stress or quitting as well. And that brings me to the end of the presentation portion, Alex.
All right, thanks so much. So thanks so much, Priscilla. I think we that really laid a good foundational set of information to launch into our panel discussion. So next, I'd like to introduce our our other panelists. So Priscilla will be one of our panelists, and I'd like to introduce Art Steinmann. Yeah, there's Art. So Art has over 45 years of experience in substance use policy, education, program development, advocacy, and health promotion work. Currently, he's a senior associate for substance use health promotion with Bunyad Public Affairs Incorporated. Art previously co-developed and managed SASSY, which is the Supporting and Connecting Youth for the Vancouver School Board. He worked as a consultant for BC health authorities, school districts, and municipalities. He was the executive director of a nonprofit provincial substance use agency. And Art is passionate about evidence-based prevention and supporting and connecting with youth. So welcome, Art. And
Thank
also
you.
welcome is, yes, also I'd like to welcome Dr. Laura Struik. Laura is an assistant professor in the School of Nursing at the University of British Columbia, Okanagan. And Dr. Struik's research background is broadly in the area of health promotion with a current focus on tobacco control measures for youth. She's particularly interested in health behavior change related to nicotine and tobacco use, and her research program is currently focused on developing and testing innovative solutions for preventing nicotine and tobacco uptake among youth, as well as supporting youth in cessation. So welcome, Laura.
Thank you.
So to kick us off, I wanted to ask, maybe we'll start with you, Laura. What is unique about vaping compared to other substances?
Thank you for that question, Alex. So I think one of the biggest things that makes e-cigarettes unique from other drugs is that it has infiltrated the youth demographics as a lifestyle product. It's infiltrated their everyday lives. It's become a part of their activities, regardless of whether they're academics, they're athletes, or anything else. It's really spread widely throughout their networks, both online, within schools, as well as outside of schools. So vaping is quite unique in this particular way. And I think it's right out of the gate really important to recognize that it's become a lifestyle product, and it's also marketed purposefully as such by the tobacco industry. So I think that's one of the biggest things that sets it apart.
Great, thanks. And so I know Priscilla touched on this in her presentation, but maybe Art, I'll ask you this question next. What are some of the common challenges related to vaping in schools?
Yeah, thanks, Alex. Well, people are probably pretty familiar. One is, of course, administrators spending an inordinate amount of time trying to manage this issue. And I think also one of the challenges is it can be, relatively easy to disguise. And so youth can sneak a hit on their vape pretty readily, even in class. So that can be a challenge. We know that a lot of schools, kind of understandably, without training or support, tend to gravitate to old style approaches of punishment, confiscation, uh, you know, telling kids not to do it, that sort of thing. And punishment really doesn't get us very far. It tends to activate the back of the brain, which is fight or flight or freeze. And we want to activate the front of the brain, where youth look at options and choice and taking power over their lives. So it takes a little bit of a reframe often for schools to get some support and training around how best to approach that. So I think there's probably more that could be said, but maybe that's enough for now.
Okay. All right. Thanks, Art. And we'll dig more into some of the evidence about preventing and addressing vaping in schools next. But I did want to offer that same question around to Laura next around what are some common challenges related to vaping in school.
Yeah, thanks, Alex. Yeah, I agree with what Art said. It's become very normalized within the school environment, and that's obviously very challenging. And it's not challenging just for youth who don't want to vape, but it's also a challenging environment for youth who want to quit. Many youth want to quit vaping, but it's very difficult for them because it has significant social implications. And many of the youth say that it would cost them their friends if they quit vaping. And when you think about the brain development at this time, it's hallmarked with forming a social identity. So the cost of losing friends during this particular developmental stage is particularly dire for youth. So it's a very challenging situation to be in. Another internal challenge, I think, within schools is the school environment has become a place where vapes are sold. Youth have spoken about mini black markets being created within schools where older youth are selling vapes to younger youth, basically bypassing the risk of getting caught purchasing them underage. So that's another internal issue within schools. And then I guess there are a couple of external issues that the school is facing, and that has to do with accessibility. So not only is the school environment difficult when it comes to purchasing vapes, but it's also the surrounding environment around the school. So a substantial portion of youth say that they get their products from vape shops, from gas stations, from convenience stores, and these retailers are in very close proximity to schools. And I'm doing a study in the Okanagan examining the spatial environment between schools and vape shops. And we're finding that middle schools and high schools often have multiple retailers within walking distance of a school. Within 500 meters, it averages two retailers. Within a kilometer, up to 10 retailers within a single school. And so that's very concerning. It just points to a major regulatory gap, but it's at the end of the day, the schools are are facing this particular challenge. And then, as Priscilla had mentioned in her presentation, the constant innovations that are coming forward from the tobacco industry to support youth from hiding their use, such as through that hoodie vape, is just another hurdle that the school has to deal with. So lots of challenges, both internally and externally, surrounding the schools. Yeah.
Yeah, great, thanks. And Priscilla, anything to add to Art and Laura?
I think what we also heard from the youth just recently is that how to access information about these products in a way that is relatable for them. So I think the challenge sometimes is finding curriculum that is evidence-based and providing that information to youth in a way that reaches the youth where it's needed. So I can relate to the fact that schools are doing their best in trying to find ways to educate the students about this topic. But there can be maybe better resources for this, or maybe standard resources to support the education piece as well.
Thanks. And I've heard anecdotally too around issues around like affecting issues like school safety, around like students not feeling comfortable going to the bathroom and things like that, as they because students are vaping in there. So thanks. So I think for the next question, I want to turn to to ask, what does the evidence say about preventing and addressing vaping in schools? So maybe again, Art, we'll start with you. Is that okay?
Sure. Well, again, it's around taking more of a health promotion approach, which is looking at the context and the environment more, and not just the individual. So a little less reliance on just facts. So, we can teach kids what vapes look like and all the ins and outs of vapes. That doesn't necessarily impact their decision making or their levels of use. It's one ingredient. It's an important piece, but it's not the only piece. So what we can do is try to strengthen some of the root issues when you look at why youth use vapes. That social factor is huge, as are other factors that can be impacted by strengthening youth's ability to feel connected, to belong, to have autonomy, to have a sense of capacity that they can actually make a difference over their lives. So there's ways to do that with a certain policy that's established, with leadership from the administration, that presents this more as a health issue and not as a behavioral problem, and certainly not as a moral or a judgmental issue. And then we can come alongside youth. We can ask youth, what do you think? What would you do? What do you think would be helpful? Youth all across the spectrum, those who use, those who don't use. And I think we can also make sure that, sorry, I'm just looking for one other point I wanted to make here. Oh yeah, I was reflecting on when we do find youth who are, quote, in violation of our drug policy, so they're vaping on school property or whatever, how we handle that is really critical. And again, we tend towards a cookie cutter, same approach for everybody all the time. I think a more nuanced approach where we seek to understand the context and setting of that individual youth, their age, their stage of use, how long they've been using, what are they using, what levels of nicotine are they using. All these things are relevant. And then we can actually, I know schools where they've set up discussion groups for youth who, a group of them were found using, they shouldn't have been, so they're invited, encouraged, they're required to attend a couple of noon-hour sessions. Maybe there's even some pizza, and you have try and set an environment for open and honest dialogue where the youth can start to raise questions that they might have, or concerns or issues, rather than just that top-down, you shouldn't do it, we're going to punish you if you do, and that just doesn't get us where we need to go.
All right, thanks, Art. So again, Laura, maybe I'll pass it on to you. So what does the evidence say around preventing and addressing vaping in schools? What would you like to add to what Art said?
Yeah, thank you. Well, I just wanted to build on Art's comment about really responding in context and I guess approaching it as in a more empathetic way. so when we think about smoking cessation, so best practice guidelines, the evidence indicates that combination of pharmacotherapy and behavioral support, like using an app or a community forum, is the best way to go forward. However, to date, we have yet to establish pharmacotherapy options for youth. And so in light of that context, we're looking at behavioral supports, and it's interesting because the evidence indicates that youth are particularly receptive to behavioral supports. And so supports that include things like counseling. So more of these empathetic, empowering options for youth is something that's really resonating with them. And so, yeah, the evidence is really supporting exactly what Art is saying in terms of approaching it more in an empathetic way versus a punitive way.
Thanks. And Laura, I know you've done some research on policy in schools. Do you maybe want to speak to a little bit about the impacts of or like the role of policy and what you found in your research there?
Oh, sure. Yeah, I'd be happy to. Yeah, so with regards to policies, I do a lot of research in the area of intervention development. So things like how can we help support them with behavioral interventions, such as maybe an app. But I think it's really important to also look at policies, because they say that interventions are only as good as their policies, and vice versa. And so policies really need to be considered as just as important as developing interventions. And so embedding mandatory behavioral support as part of a school policy is likely to be a productive way forward. So in a study that we've conducted, we examined school policies just to understand the nature of the policy. So are they, what types of policies are implemented? Are they implemented? Are students aware of these policies? Do they feel like they're being enforced? And we interviewed youth to get their perspectives on policies, and youth said they think policies are very important. It makes them feel safe. They really want to see them enforced more, but what is really missing is complementary behavioral support in the policy. So it's not just if you are vaping, you're going to be suspended or expelled. It's okay, we have a zero tolerance for vaping on our campus. If you are caught vaping, you're going to be put on a pathway to support you and understand why you're choosing to vape, and provide you with some resources to maybe think about, engaging in this behavior, especially on school grounds. So it's not about being lenient towards vaping on campus, or it's more about putting them on a supportive pathway versus a punitive pathway. And there's lots of negative implications to going down the punitive road, which I'm happy to speak to, but I think we might be touching on that later potentially. So, but yeah, youth really wanted to vocalize the importance of embedding a behavioral support pathway within policies.
Oh, that's interesting. Thanks. And Priscila, I know you highlighted a number of current emerging practices that schools can work on. Is there any that you would like to kind of build upon?
Yeah, I resonate with everything that Art and Laura said, and I think one of the things that is important for us to think is also a lot of the prevention has nothing to do with the substances that we're trying to prevent at all. So encouraging healthy lifestyle choices and providing students with the opportunities to develop some skills to achieve that is also important, and will help with the vaping prevention efforts as well. So, for example, instead of just focusing on messaging in the long-term risks of vaping, maybe something that is more salient for youth, maybe more immediate risk factors. We also want to talk a little bit more about emotional and social risks, and also benefits related to not using these substances. What are perhaps the benefits of delaying or not using vapes at all? And we also want to empower the students when they are faced with the choices. And that comes down to having that social emotional learning really early on, and being able to navigate certain situations, and having the refusal skills if they're caught in a position that requires them to say no. Not only being able to say no, but how to stay comfortable in being different in that situation. So all of that emotional development that requires some self-reflection and some identity formation needs to happen, and it needs to start early as well. And that will not only just help the students make good choices for related to vaping, but for their health in general.
Okay, thanks. So I think some of you, actually, I think all three of you have touched on this, but I'm kind of curious if there's any other thoughts from any of you on like maybe some other popular approaches that maybe the evidence really doesn't support the use of. So I think we've talked about maybe punitive approaches not necessarily working. I'm wondering if there's any other thoughts on other maybe popular or common approaches that maybe really doesn't have the evidence to support that its use? Art, I see you smiling. Is that something you
Well,
want
I
to take
see
a stab
Laura
at?
nodding, so
Oh,
how about
Laura
Laura, you
nodding.
go
Okay,
Okay, do you want me to speak to it
Sure.
first? Okay.
Sure.
Well, we all hear about vape detectors. So
Okay.
that's something that schools have implemented or are thinking about implementing. First of all, they cost a ton of money. And second of all, they're likely going to push youth into using vapes in an even more harmful way, like stealth vaping. So stealth vaping is where youth hold the vapor for longer in their mouths and lungs, and this will allow the vapor to actually dissipate within their body versus through exhalation. And so this basically lends to a longer mouth, throat, and lung exposure to the vapor, ultimately enhancing nicotine dependence as well as exposure to disease risks. So things like vape detectors are essentially going to not only put them into a situation where they're engaging in this high risk behavior, but it also puts youth in a position where they're going to be innovative with their devices. So youth are actually manipulating their devices in order to make it so that they can produce less vapor, for example. And doing this modification poses significant risks to them as well, from burns to lung injuries. And so things like vape detectors actually have some significant health implications for youth on that front. I know we talked about punitive punishment, and yeah, just building on what Priscilla was saying and thinking about the presentation that she gave at the start. Why are youth vaping? The number one reason is stress, according to the Canadian Tobacco and Nicotine Survey. So for youth who are struggling with stress or anxiety, punitive measures like suspension or expulsion are going to only enhance those feelings. And there's lots of research that indicates that suspension and expulsion results in significant mental health consequences, not just for the student, but also actually for the entire student body. So there's lots of research to indicate that these really aren't the most productive ways forward. And as I had mentioned, it's really not about being lenient with policies. I think it's, as youth had said, it makes them feel safe to have a zero tolerance policy and to enforce it. But how you enforce it is what matters. And so if you enforce it and by putting them on that supportive communication pathway versus putting them on a suspension expulsion pathway, it can make a huge difference. Art,
Yeah,
I'll let you build on that. Yeah.
Well, I just, you're so right. And adults, unfortunately, we don't mean to, but we add a lot of stress to young people's lives often. We add a lot of anxiety to their lives. So we need to look at ourselves too, parents and teachers and administrators, and see what can we do and ask the youth, what are you finding that's stressful or challenging for you? Are there any things we could do differently? At least give them an opportunity. This whole notion of youth wanting to self-soothe to deal with their stress and anxiety, we all deal with that. So we can do more to model and promote healthier ways, going for a walk, having a bath, talking to a friend, taking deep breaths, all those good things that we know, but we just need to keep reinforcing those with young people as well. And we need to be realistic. So, withdrawal does happen. Some youth can't get through a 90-minute period without feeling physical symptoms from the lack of nicotine in their body. So are we being honest about that and having discussions about that? What could be done? And the last thing I'll just say quickly, I remember I was reminded of talking with one youth who their school said, okay, we're going to give you a free coupon to the cafeteria if you turn in your vape. And I asked this youth what they thought of that, and they said, "Oh, yeah, it's great. I've got an old vape at home. I'll bring that in, give them that one, and I'll get my lunch, and I'll carry on using the vape I have." So, it is complex, but if we get youth on side, there's a lot more progress that we can make. I'm convinced.
I think one of my last questions before we get to the Q&A is, and maybe we'll start with you again, Art, is how can staff support vaping cessation or supporting youth to get help for vaping?
Well, again, it's not one size fits all. So we need to think about the youth that's presenting. What age are they? What stage are they? What's going on in their lives? How are they doing? How are they managing overall in their life? So those are important things. We all know about the stages of change theory. So that's where we take into account their readiness. Are they incomplete? I have no problem. I can quit anytime if I want, leave me alone. That's one approach. Another approach, they might be contemplating. They might be thinking, yeah, maybe I should cut back a little bit. And I would encourage people to think of those words, cut back, as well as quit. Quit's a big jump. But we can say to youth, hey, would you consider reducing? And one way they can do that is to move to vapes with lower nicotine levels. I know one guy who went down, 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 down till he was using, vapes with very low nicotine levels, and it really helped him. So there's things like that that we can take into account. Um, I think we need to be honest about we talk about the pros of not using and the cons of using, but we don't talk about the pros of using and the cons of not using. And those are realities that kids deal with every day. We've touched on it already on this panel. So we need to get more comfortable being honest and open about some of those things. We do it in other areas. We do it in physical fitness. We do it in heart health, but there's so much stigma and aura around this. We're hesitant to step in and really talk honestly and openly, but we need to do that. Yeah. So more empathy, more understanding, and a lot more listening to youth would be some of the things I would suggest.
Thanks. And maybe Priscilla, the same question. Any other things to add on how staff can support vaping cessation or supporting students get the service they need?
Yeah, I think building on what Art was saying, people might want to access services in different ways. So having information about services that maybe the student is not ready to self-disclose to you, but having that available widely so people can access that information is a good place to start. I think that coming from a place of curiosity and supporting the student and really asking what's happening behind the behavior is really important. So recognizing that people are doing this, that vaping or using other substances for various reasons, understanding maybe underlying factors can be a way to support the student where they need. And what we also saw from students say is that part of the messaging usually focus on non-use or addiction, and there's nothing said about the in-between. So maybe expanding the conversation into where are you with your use is an important step as well, because there's a full spectrum of how people are using these substances. And sometimes when kids are found experimenting or having more regular use, but they haven't necessarily developed an addiction yet, they don't feel like they can make a change to their behavior because they haven't reached that point. And that's what we heard from you. That's from their perspective. So offering that full comprehension and being that person to have a listening ear and somebody to support the student where they're at can be a great way to help the students find their way, navigate through this.
Okay, thanks. So thank you very much. I really appreciate this discussion. And I mean, I personally feel like we could have another half hour worth of discussion on this, but I want to recognizing the time and there are some questions in the Q&A. And for the people who have asked the questions, I want to acknowledge that there's some good ones in here. We won't be able to get to them all, given the time we have, but so maybe I'll start with this one. So we have someone here who's asking, They said that they've had a lot of they've heard about and have a lot of difficulties initiating changes to policies and practices. So we've talked about some good ideas in this discussion around what might be some changes to policies and practices that schools and school districts can make. And then this person asked, teachers are overworked and understaffed, teachers, principal, and other school staff, the principals overworked and understaffed, or may not believe in necessarily the importance of these kinds of approaches. So what are some of the ways that we can facilitate change? I think that it's adding one more thing to the plate, and like a lot of these solutions sound good, but there's a lot of them, maybe take more, it might take more time to talk to the students and have some of these things rather than suspending them, which doesn't take as much time. So how can we start to work with this? How would you suggest working with the school system to start implementing some of these policy or practice changes? And I'll just kind of open
One
up to.
thing I've seen some success with is look at school goals. So talk to administrators, teachers, trustees, even parents. What is the school trying to achieve? Well, they're trying to achieve educated youth who graduated in grade 12. These other social issues can really interfere. These health issues can really interfere with that goal. So that's one way to try and help bridge, why would we be talking about vaping? Why would we have a less punitive approach? Well, there's very good reasons, and we can have data for that. The other thing I've found really powerful is youth voice. So if I remember bringing together some people in Vancouver District and senior management as well as counselors and others, and we insisted and push for having a couple of youth come along. And the youth came along, and what they had to say had more impact and carried more weight than anything any of the adults said. So, if a caring administrator hears a youth saying, I don't want to smoke as much as I do, or I'd like to cut back, or when you punish me this way, here's the results, that can really have an impact. So there's a couple of ideas.
So, Laura, anything to add to that?
I think I completely agree with what Art said, and I think the time that is, again, going back to the presentation by Priscilla, you saw how much time is being dedicated by school administrators right now to the issue of youth vaping. So if we are spending that much time potentially using policies that aren't serving us as well as they could, perhaps spending a little bit more time revising those policies upfront will eventually pay off in the long term and from a time perspective. But I think one of the key things is actually to bring in youth, just like what Art was saying, bring youth on board to address the issue versus just relying on teachers or administrators to work through the issue. Youth want to be involved. This is an issue that they actually are very passionate about in terms of addressing. They want their school to be safe. I saw a comment about how youth are unable to go to the bathroom, and I've heard youth anecdotally about how they're developing UTIs because they are not going to the bathroom, they're not drinking water because they don't want to be exposed to vapors. So bringing youth on board, I think would be extremely powerful. They know their context more than any of us, and so bring youth on board, bring them, invite them for input on building new policies. And you could create a youth advisory board and help work through the issue of youth vaping. You could bring potentially engage in shoulder to shoulder activities. So it's not like, hey, everybody, we're going to have a conversation about vaping. It could be, we're going to do this art class and we're gonna have a shoulder to shoulder conversation about vaping, and that's where they have that safe space to start talking about it. So yeah, there's lots of things that could be done, but I would certainly encourage youth involvement when trying to implement these changes.
And another, just a quick point, if I may, is inviting schools to look at how's it going. Here's what you're doing now. What are the results you're getting? Oh gosh, you got drawers full of vapes. You've got parents coming in for meetings. You've got kids still vaping. You have kids traumatized about the washrooms. So you know what? We can do better. And exactly what Laura was just saying, put together a cross section of people from the school community, students, parents, teachers, administrators, have some discussions, start to get the ball rolling. And you can bring in people like Priscilla and others as a resource and look at some fresh new ways to approach it.
Yeah. And sorry.
No, go for it.
Just wanted to build on what Art was saying. Yeah, I think bringing in other people who are important in youth lives, like parents and coaches, is also really important. Lots of research that indicates that parental disapproval is a significant protective factor for substance use in general, including vaping. So really, not treating it as, oh, at least they're not smoking, or being indifferent towards the behavior is basically condoning the behavior. So, yeah, if parents are aware of vaping and how their role of disapproval and just inviting youth to have curious conversations at the end of their school day, like just be curious about what's going on at school and what they're seeing in relation to vaping. We'll give them a safe space to have that conversation. And, coaches also play a significant role as a role model in the lives of youth. So there are lots of other individuals that could be engaged in this process as well.
And parents talking to trustees can create quicker change than anything bureaucratic.
All right, I think that's a lot of good ideas. And I just maybe a really quick last question for Priscila. So, also wanting to acknowledge that, there's already a lot on the school's plate. Maybe you could just speak briefly to how health authorities and folks like yourselves can come alongside and support the work that is happening in school around this issue.
Yeah, thanks, Alex. Yeah, we can facilitate multiple things, and each health authority will have representatives that are working directly with schools. Some of us focus specifically in vaping and tobacco, or some of us focus on illegal substances. But we can provide resources. For example, if you need some guidance in finding evidence-based curriculums and things of that nature, we have information to give to you, so you don't have to spend so much time looking through all of this information and trying to figure out what's the best approach. So we can also help you tweak your policies and support some of your changes. And obviously, we would love to see policy changes at a district level, but that is it can be a time-consuming process. And schools can start at the school level with your code of conduct and how you approach this issue at your school. And that's something that might be a little easier to start with and implement. We can also offer, for example, in my district, we are piloting an alternative to suspension program with a few schools, just to try and support the administrators in finding ways that are easy to provide that support for students instead of resorting to punitive approaches, and really fostering that connection with the students. Other than that, we are here to support your work, and happy to have any type of conversation about the legal substances that youth might be experimenting, providing resources for your parents, and maybe pro-D days for your staff. So really lean on us for that support if you need some extra couple of hands to figure out what to do next with your approaches at your school level.
All right, thanks so much, Priscila. I really appreciate that, and thanks to all three of our panelists, Priscila, Laura, and Art. I really appreciate the conversation, and again, feel like I could have another half hour easily, but we're running out of time. So thank you so much. For the rest of our audience, I would like to just to mention, if you want to stay connected with our newsletter, with our team, you can sign up for our newsletter. You can see the link there at the bottom, where you can sign up, keltymentalhealth.ca/school professionals. And just really want to thank you all, as well as our panelists, for taking the time to join us today and learning about this topic together. And I hope you found it useful and informative.